Podcast Studios. This is After 9 with Scott and Kat.
Hey now. Hi, everybody. Welcome to another episode of After 9. It's the day after the day after. How you doing, Kat?
I hope it sounds better for people. We are in a new studio. Fun fact, we actually have a new studio, but we're working on some glitches and things, so hopefully this sounds a little bit better. So to those who did take note of it, yeah, we know. We're working on it. We just wanted to get you something yesterday.
You know, it was the same thing when we started at the last temporary podcast studio. Now we're in the podcast studio, and yeah, there's always some things that they got to work out. So we will trust our amazing engineers to get that figured out. And today is not going to be a particularly long one, by the way. Part of the reason for that is, and I'm a little surprised, Joe Biden is doing a news conference from the White House at 11 a.m. Biden hasn't done a whole lot of news conferences. He's not exactly...
Sharp?
There's a good
right
way
now,
to put it.
These days, anyway?
There's a great way to put it. He's not, but I'm curious to hear what he has to say. Is he going to come out and urge supporters of Kamala Harris and him to be kind, to support Trump, to cheer on the future of America? Is there going to be any talk about what I keep hearing nonstop on Canadian media? Have you noticed this, by the way, that everybody is treating this like a doom and gloom story, that Donald Trump was reelected president of the United States?
Yeah, I'm seeing a lot of like things like that. There's thankfully mixed into that. I'm seeing a lot more of like, listen, this is the hand you've been dealt, if you will. If you're unhappy about it, this is the hand that we've been dealt. Let's still strive for this, that, and the next thing that matters to you. Band together where you can. I don't know. It's a lot of those kinds of things. So it's either, yeah, I hate life, I want to move away, or, and I talked to a couple of people from the States yesterday that were like, can I come there? I'm like, well, shit's not that much better here.
No, it's really not.
Like we have our own set of problems here. I don't know if you're going to want that, but. So I saw a mixed bag, actually.
Let me give you an example of a story that was published by the Canadian Press. If the U.S. election has left you feeling wiped out, you're not alone. The Canadian Psychological Association says the results declaring Donald Trump as America's next president have a worldwide impact, and it's normal for Canadians to have emotions about it. You know, when Joe Biden was elected in 2020, I don't remember stories like this. And I'm not just talking about the Canadian press. It's CBC, CTV, and the list goes on and on and on, just assuming that Canadians are devastated at this news. I don't know. I mean, I go through my DMs. I go through the text messages from people who listen to After 9, and people don't seem all that upset about it. There's some who they don't like it. But others, I feel like they're just piling on because they think that's what they have to do. I think this is great news for America. To be perfectly honest with you, they're already starting to plan the transition, and that's part of the reason Donald Trump has now been invited by Joe Biden to go to the White House for a sit-down meeting. They haven't met face-to-face. Not since, I think, when they were running against each other in 2020.
Awkward. It's just awkward.
It's totally awkward. They talked a lot of shit about each other.
Yeah, they have to go through the motions, and that's fine, but it's so awkward. You know what I can't stand is that one way or the other. I hate, like, the people online, one way or the other, who are just like, this is the worst. If you voted for this, F you, blah, blah, blah. On the other end of things, I can't stand the, suck it, Kamala lovers, blah, blah, blah. Like, can we just let things be? Like, I don't know. This is coming from a place where I don't care that much. So maybe that's why it's bugging me so much. Either way, I like, just chill out. Don't make it your entire existence. Don't let it stress you out, and don't be a prick about it. Like, either way, for me, I come from that stance, though.
Nobody likes a sore winner or
exactly
sore winner or sore loser. We don't like them.
I wanted to mention this because I thought this was funny. Along the vein of like, everything's going to be okay, that kind of thing. I saw this story come down. TMZ posted it. My friends at the Calm app, I have a Calm sleep story, by the way, on the app Calm. It's a meditation app. There's actually a story called the TikTok Tale, if you want to look it up, whatever. But my friends at Calm saw a 100 spot jump in the App Store after the ad that they put out during the election results campaign. Did you see this ad?
I did, and it was brilliant.
I know that marketing department. They're fantastic, and I thought that was brilliant, and it's clearly paying off for them. A 100-spot jump. But think about that for a second. People watching those election results felt that stressed out. Let it ruin their days so much, or maybe there's were people who were thinking about getting it anyway. Who knows? That they were like, yeah, I'm going to get that app. I'm going to do that because I need to de-stress. Anyway, I thought it was brilliant marketing by them. It really did.
I want to try and balance out a little bit of what you're hearing, the hyperbole in the Canadian media, and say, if you're happy about this, if you're excited about Trump being elected, if you're optimistic that the economy is going to turn around, if you're optimistic that the border is going to be secured, if you're optimistic that jobs, good paying ones, are on their way, good for you. You have every right to be, because chances are you didn't like what went on for the last 4 years. I just feel like there's not a lot of balance in the media these days, and to just assume that this is devastating news for Canada. I mean, our finance minister, Chrystia Freeland, came out yesterday and said, I want to reassure Canadians, everything will be okay. Yeah, it's going to be great, actually. In fact, the only emotion that I anticipate feeling is jealousy that they're going to have their house in order and we are not doing much to get ours in order because we've got some economic problems here too. But the Biden press conference is coming up at 11. I do want to watch that and take some notes. So in the meantime, there's not a lot to cover on the election front. Let's move on to some other things. Our federal government has ordered the dissolution of TikTok's Canadian business following a national security review of the Chinese company behind the social media platform. Our industry minister, Francois-Philippe Champagne, funny little fella, says the dissolution will address the risks related to ByteDance's establishment of TikTok Technology of Canada. He says the move will not block Canadians' access to the app, but will allow for a review of foreign investments that may harm Canada's national security. Obviously, you probably have an opinion on this, Kat, because you're one of the main voices on TikTok. You'll still be able to use it, but they're not going to be able to have Canadian offices or market to Canadian businesses that want to advertise on TikTok. And frankly, I'm still not sure why.
I think there's going to be loopholes with this, is what I will say about some of this, especially when it comes to advertising, because you can still absolutely advertise and you can do it through people. You know, you can do it through TikTok creators very easily. And for them, that's some of the best marketing they can do. A lot of the time, it's been proven actually that the endorsements that they do through these TikTok creators ends up making them more than just having a flat out advertisement. So again, there's loopholes with all that stuff. I would like to know details though.
Me too.
Tell me what exactly you are afraid of. Give us details because it seems like you're just saying a bunch of words, but you're not telling us your actual fear.
Right.
What is the fear? What have you found? And I bet you the answer is I haven't found anything. We're just afraid of what we feel we can't control.
Or they just don't like Chinese companies.
Or they don't like, well, and that's the other thing. And we've seen that before in the States. They're fighting against TikTok there as well. I think that's ongoing, right? I mean, that hasn't ended yet.
No, it hasn't. We've gone further here in Canada. We banned TikTok from all government paid for phones. Okay. I mean, everyone from the cops to the deputy prime minister can't have TikTok. All right, fine. But the rest of us, we should be able to use an app. And it really shouldn't matter where it comes from. What I don't understand about this is they keep citing things like national security risks. I don't see the risk. You're not doing anything different on TikTok than you're doing on Instagram or doing on X or any of the other social media platforms. And I only named a couple. There's dozens and dozens and dozens of these platforms. Like, are we watching all of them or are we only watching the Chinese one? I don't understand that. The other thing I don't understand is what could China possibly do with this information? Let's say the theory that is being floated out there by the government that they're spying on us through TikTok. Let's say that is true. How? Like, is there someone over in China watching to see if you got the dance moves right for the latest viral sensation or monitoring to see if we happen to leak any government secrets in this? There are no secrets. I don't understand what the problem is.
I don't know either. And it's mind-boggling to me. So I love the CEO of TikTok. I think he's great.
He is so good when he goes in front of Congress in the U.S. because he handles himself so well.
If you're really interested in reading more in it, it was an issue in Wired. Listen to me. An issue in Wired magazine that I just read an article where he sat down with Wired magazine with one of the journalists there. And he kind of explained his mind being blown by all of this stuff. Now, that was particularly in the States, not necessarily for what we're talking about more recently in Canada. But you can hear him even speak on it. And it's, again, for me, it's nothing but I feel I can't control or we can't get access to you because you're in China and ByteDance is a Chinese corporation. So That's why I don't like you. I just don't like it because you might grab data that we have here. Like, again, it's nonsensical to me. You're not giving us details. You're just saying words.
I did get an interesting reply on X today from someone after I did this story in the news on the Scott and Kat radio show. And that person said the big fear is that they control the algorithm and they can manipulate the algorithm however they want.
Yeah.
And TikTok has been brilliant at creating that algorithm. It's addicted millions of people.
Give me a cocksucking break, though. Elon Musk controls the algorithm on X. You know what I'm saying? Like, you can't pick one. Like you said, you can't, like, pick one and not the others. You don't know the algorithms on any other platform. Or do you? And if you do, then tell us that you know that information. You're privy to it. And you're not privy to anything on TikTok, and that scares you, and that's why. Yeah. Politically, we know that things are driven either way. We know Mark Zuckerberg has been questioned about it. We know Elon Musk is questioned about it now, currently. We know TikTok has been asked about it. I don't even know if it's a political or not. It could, by all means, not be. It could be something else. Yeah, the algorithm's brilliant. The algorithm's brilliant. I don't know it, obviously. Like, they don't give me,
you?
Nor do I.
Are you a Chinese spy?
Although I work with ByteDance, I cannot confirm that I know about the algorithm. But I can tell you it is extremely complex, and that I think scares them more than anything. So I'm not surprised that got brought up.
Yeah, it is weird to leave it where people can still use it, but they're not allowed to operate in Canada. And frankly, I'd like to know a little bit more about what the major concern here is, because they've scared a lot of people. What we're saying right now, I think generally, is not the popular opinion. I think enough people have been scared by watching Canadian news to think, oh, TikTok's bad. The Chinese people, they're spying on us because of TikTok. And
I know. I hope more people read into it more than that. You know?
I hope so, too. Healthcare spending expected to outpace the economy and reach a new high in 2024. The Canadian Institute for Health Information says total health spending is expected to hit $372 billion this year, Kat. That's a little over $9,000 per Canadian. Now, they say it's not unusual for health expenditures to outpace economic growth, but the report says this could be the case for the next several years or longer because of Canada's growing and aging population. They're spending $9,000 per Canadian to deliver this healthcare system that we have. And it's not really working.
Is it the healthcare system we have, or are they hoping that money will be used to improve the healthcare system? Just so I can clarify.
Nope. This is just to keep the doors open and the lights on and the doctors getting paid.
Hot into the collar with that one.
No kidding.
Our healthcare system's not good. I mean, all of us have a story, I think.
Everybody.
And if you don't, you will soon. If you're like, I don't really use the hospitals much. I don't know anyone who needs an MRI right now. I don't know it. You will eventually, and you will find out very quick that the system we have right now, I mean, I don't want to say broken, but it's not good. It's not complete. It's not, I'm definitely not even close to perfect. I don't know if any healthcare system's perfect. I question the whole thing. I don't like it.
Well, it seems to me when you look at how much we're spending, and this comes right off of our checks, everyone. As you know, healthcare is paid for by the government, but we pay for it because of the deductions off of our check through our income taxes and so on and so forth. Well, it seems to me that if we're paying $9,000 per Canadian, for example, in your house, Kat, that's 9,000 times 4. Your household is paying a lot of money for healthcare. In my household, I know that I'm not spending $9,000 a year in my annual checkup at the doctor. So it means some people are spending much more and others are spending far less.
Yeah. And we know surgeries and things like that, they're expensive.
Sure. But in the States, they have to, as part of Obamacare, which is still intact, they have to have health insurance so that when they go to a hospital, the hospital knows they're going to get paid. And some people don't comply and they end up in a serious situation where they get big bills. I've seen them online. $30,000 to spend 2 nights in a hospital having a baby.
Yeah.
You know, like it's nuts. But your health insurance is meant to cover that if you happen to get sick.
Or at least cover most of it. Yep.
Let me offer you an option here. You can continue to have, for you, $36,000 of your household's income redirected to healthcare spending via taxes. Or the government gets out of it. We have private people operating the healthcare system, and they're going to run it like a business. They want to get paid, so it'll be compulsory for Canadians to have health insurance. It'll cost you about $3,000 a year per person. and you're going to get far better results. In America, their healthcare system, it can be expensive, but people, when they need help down there, they get it. You need a surgery, you're in. You need an MRI, there's no more driving to Timmins at 4 o'clock in the morning to get that done. You'll get it like the next day.
Yeah.
Their system works, and people are not paying, in a lot of cases, money like that.
Yeah, and not to mention, it's like a hotel when you go there too.
They treat you well.
My aunt,
because you're a customer.
That's exactly, and you can choose because you can literally go, do I want to go to Red Blue Hospital? Do I want to go to this hospital or that? I think I'll choose this one. And they're like, oh, please come on in. Thank you for choosing us. It's just like choosing from the Marriott or the fucking Hilton.
Yeah. Oh, I think I'm going to take that hospital because I know that at that hospital, they bring me a coffee when I'm in the waiting room, and they've got donuts and sandwiches and stuff like that.
And I know that's expensive. Like, I get it. Like, yes, they are paying for that. Yes. And like you said, hopefully your health insurance covers most of it. My aunt, I'll tell you quickly, my aunt had to get a stent put in while she was in Florida. So there was a medical emergency. She obviously wasn't planning to be there for that, but there was a medical emergency. She ended up in the hospital, got a stent put in. She said it was the nicest time she's ever had, and it was at a hospital. They treated her like absolute gold. She was luckily covered, obviously luckily fine. She got her stent put in. She looked at what it would have looked like in Ontario. It's comparing apples to cantaloupes. You know what I mean? Not even close.
It's like a limo versus a bus.
Honest to goodness.
I really don't know what it's going to take to get Canadians to this place, because as I look down the line, I think that's where this is going. Now, I don't know if that's the way the province wants healthcare to go in Ontario and any of the provinces. I don't know if that's the way the premiers want this to go, or if they're really desperately trying to preserve the system we have. But if we're spending $9,000 per person, I don't think we should be happy with the results we're getting here for that amount of money. Not when I look at how much it costs to buy insurance and get treated like a king or queen when you're at a hospital in the States with no waiting and with definite accountability.
Yeah.
How many people have gone to see their family doctor and left thinking, I'm not even sure that they knew my name before they looked at the chart? Down there, you get treated different because you're a customer.
And also the backlog, like all of it. The reason is the backlog is not there like it is here because you are paying for it. So the people who opt to go to the doctor because they've got a slight cough or a sore throat, far few in between. No one's going there for that when they know they're going to pay a pocket for it. And also, they should know it's a waste of time here, but some people just don't.
Kat, this is another controversial subject. A new study says hundreds of people are going to lose access to the supervised consumption sites in Toronto next year when the province shuts them down. The Ontario government announced over the summer it was closing 10 supervised consumption sites across the province, including 5 in Toronto at the end of March 2025 because they're too close to schools and daycares. Researchers with St. Michael's Hospital say that will lead to more public drug use and more overdoses. The researchers looked at data and found that on average, more than 500 people use the Toronto sites that are slated for closure monthly in 2022. Okay, so we got about 500 people a month going to these things to do their drugs and stuff like that, although we don't exactly know why they're going there. We have a supervised consumption site in Kitchener where we do our radio show from, and while I haven't been there, I've certainly talked to enough people that have or work there, and one of the services they offer that's quite popular is you can go in and get your drugs tested. The stuff you bought off the street, if you want to make sure that you just got X drug and you don't want to make sure, or you want to make sure that there isn't something else laced in it, they'll test it and say, okay, this is 0.2% cocaine, it's 50% fentanyl with a little bit of hash mixed in or something like that. They'll give you the whole composition of it. That probably makes things safer. As far as actually going in and getting the free needles and the free drugs and all those other sort of things, I don't think the public at large is going to stand for that much longer. We saw that it didn't work in BC. Ford is being preemptive here in Ontario and shutting them down before we start giving away free drugs to everybody. And frankly, I think if I'm reading the room right, the public wants these things either way out of sight or at least not near schools and daycares where some of them are now, because it leads to a whole bunch of problems in the community. But we also don't want to leave behind the people that are truly struggling with a drug addiction. I don't know what the right answer is here. I'm so torn on it, but Community safety has to be paramount here, I would think. We can't have a bunch of discarded needles laying around on a playground where kids are going to go out for recess.
Agree, but the problem lies in that some of those areas have kind of formed themselves at parks. You know what I mean? So I get having a designated spot because I totally agree. Get it away from schools, get away from this, but you can't control it all because there are still people who are doing those drugs in places that, and they're not in their right mind, obviously. So it's not like they chose maybe to be near a child care center or any number of places, right? It's a tough one for me too. It's one of those subjects when we talk about it that I'm like, I truly believe when it comes to that, we have to leave it to the people who work on the inside to tell us more about it and educate us on it. Because if you don't know anything about it, like I don't come from that world at all. In healthcare aspect, I don't know anyone who's used them. I don't like potentially or not. So I feel like I also can't give an opinion on it. You know what I mean? I don't feel it's right.
Yeah, I'm conflicted on this too, but I also want to know that if we're going to talk to somebody who works there, for example, I want it to be objective because right now there's people who I don't think anybody's going to be out of a job. They'll surely be reassigned because God knows we need more nurses, public health nurses, and so on and so forth. I don't think that those people are going to be out of jobs, but they certainly are passionate about what they do. Can we objectively have a conversation about risk versus reward? Reward is, okay, these people have got a safe place to go. Risk is we end up with some kid stepping on a discarded needle and getting high on fentanyl and contracting whatever disease when they were out doing normal things that kids do. Mm-hmm. That's a big one for me. I don't want that at all. I also don't want the problems of people who are high on drugs, terrorizing neighborhoods, breaking into people's homes to steal money or jewelry to go and buy more drugs. You know what I mean?
Yes.
And I don't know if we're ever going to get a truly balanced conversation on this where the public can say, hear that argument, hear this argument, and make an informed choice. Everybody's very dug in on their side. And it's hard for people like us and people listening to After 9 right now to form an opinion on these because it should, in theory, do a lot of good. But in practicality, it's not doing much good. In fact, it's making communities worse off. And I worry about these people that are addicted, but I also worry about homeowners and people that just want to live in a safe community. So I really don't know where we're going to go from here, but I don't know that I buy into the doom and gloom that it's going to be The Walking Dead with people roaming around the streets shooting up drugs. I think it'll probably go back to the way it was before we had the supervised consumption sites where people will just duck into an alley or whatever and do it there. That's not ideal either.
I know, but none of it's good. You know what I mean? There's no good solution because either way, you are going to have people that are drug users.
Yeah,
that are going to use drugs.
Yeah,
and where they do it isn't in our control at that point. So. It's a tough one. I hear you.
One more thing. Apparently, we are a step closer to getting a major transit project underway. Kat, how long? Certainly the whole time that we've been on Energy 95.3, which is Hamilton's radio station. Certainly the time that we've been on there, they've been talking about getting this LRT built, Light Rapid Transit, LRT, an above-ground train that rolls right through town and takes people where they need to go-ish. They only just issued a request for qualifications for contractors for this LRT project. The work will include utility relocations, roads, bridges, sidewalks, traffic control signals, and more along a 14-kilometer alignment. The province says once complete, this LRT is going to carry 50,000 daily riders across one of Ontario's fastest-growing cities, Hamilton. Who estimates these things? Who estimates these? How do you figure 50,000 people a day are going to ride this LRT? They're probably using some mathematical formula based on population. I don't see it. We have an LRT in Kitchener, and as much as I love the Ion train, let me tell the folks in Hamilton a little bit about what goes on with the Ion train. Every time I see it, there's people on it, but it's not full. There's certainly not 50,000 people a month using the LRT in Kitchener, by my estimation anyway. Maybe I'm wrong on
There's
that.
some weekend, mind you, there are some times where I see it and it is full. And it is full.
And you know what? It's probably efficient to run it. I don't know what's better for I have to assume this is better for the environment than driving buses around in circles all day long that are empty.
Yeah.
By the way, I think I figured it out. I think part of the reason that particularly in small towns, like I live in Burlington, we have our own transit system. but they're all wrapped with ads for local realtors and people like that.
Yeah.
And I thought, well, that's kind of distracting. Then I realized I think they put that on there so regular taxpayers don't realize that bus is empty. That bus is empty. Oh, there's nobody on that one either. That we're just constantly rolling buses around empty. LRTs are probably the way to go, but they only go where the tracks go. And for whatever reason, it costs a fortune to lay down these tracks.
I would love to know the numbers in terms of the cost of that. Sure, this is all included. How much does it cost to fix them when inevitably somebody runs into one or two, or they run into a car?
Yeah, this is another warning that we can give Hamilton folks about our experience in Kitchener. Almost daily, a car crashes into it. And you might think to yourself, how could a car hit a train? There's no way you didn't see a train coming. Happens all the time, like almost daily. For whatever reason, people go to make a left turn and then bam, right into a train.
They make a turn, but they make a turn by accidentally into where that track is, or like the signs, they aren't paying attention to the signs. I think the signs are perfectly clear, but anyway, maybe that's a conversation for another day. However, yeah, that does happen too. So anyway, I'd like to know like the cost of all of it at the end of the day.
I'd like to know why it takes so long. They approved this project years ago, and we're just now getting around to asking for contractors to bid on doing the work like relocating utilities and building roads and bridges and sidewalks and traffic controls around it. The hell have you been doing for the last few years? Mm-hmm. Yeah. So now I'm starting to understand why that Eglinton Crosstown LRT in Toronto isn't built. These things work at a snail's pace. Whatever happened to? Because if this was us, regular people, and we wanted to buy a train, if I went to Bombardier and said, hey, I want to buy an LRT. I've got some tracks at my place just to toot around my own property. They'd say, okay, here's how much. And I'd say, well, when can you deliver? I'd be a priority. They'd give it to me as quickly as they could. They'd build it. They'd ship it. They'd get their money. We'd move on. I feel like our procurement process is a little messed up around here. Maybe we should stop paying things up front. Maybe we should just get a total bill and you come to us with the bill once it's built. Because if nobody's getting paid until this thing is rolling, I have a feeling it would get built a heck of a lot faster than it currently is being.
Yeah, I mean, I don't know the ins and outs of the procurement process, but it always does seem like a while.
And on that, we will say, have yourselves a great day, everybody. We will be back tomorrow, possibly with Dave Blizzard, if we can find a third microphone and chair for this new studio. Have a good one, everybody. We'll see you tomorrow.
Bye, friends.